Important question, and estimated that 3,500 infants die every year in the U.S. due to sleep-related deaths. So joining us now to talk about safe sleep is Olivia Burgess. She is the clinical nurse manager in the family birthplace at the Hospital of Central Connecticut in New Britain. Welcome.
Thank you for having me.
You know, this is something that I know new parents always worry about, but it's important for caregivers as well. So when we hear the term safe sleep, what does that really mean?
So really what the term safe sleep means is putting a baby down in an environment where they are safe and harm will not come to them, to prevent the baby from choking, suffocation, or SIDS, which is sudden infant death syndrome. The recommendations are really in place from the moment a baby is born until 1 year of age.
And so as we go through and know about, people like bumpers, they like toys, but what do you think about placing any items in the crib with a baby?
So you really don't want to have any items in the bed with the baby. A lot of parents are so excited to put stuffed animals along the side of the bed, put a big fluffy blanket on top of the baby to make sure the baby is warm. But any of these items can cause suffocation. It's very easy for a baby to move in its sleep. And you can see here, I have a visual in front of me, the blanket can come right up over the baby's face and cause suffocation while it's sleeping. So you really want to remove any item from the crib that's not attached to the baby, like the sleep sack or the swaddle.
So the best general recommendations for sleeping?
So the recommendations are that, as you can see here, this baby is flat on its back on a flat, firm surface. No other items in the bed. The baby is swaddled here. Your infant can be either swaddled or in a sleep sack. And there really should be no other items in the bed. The temperature should be moderate, not too hot, not too cold. And in addition, the baby really shouldn't be sleeping anywhere that they're at an incline, like in a swing or in a chair or anything like that.
Well, I know you've done so much to educate parents, and you've just been named a Gold Safe Sleep Champion by the National Safe Sleep Hospital Certification. So the Hospital of Central Connecticut got this really nice national recognition. So that's great, and I know you're doing lots of work to educate others. So if anyone wants information, they can visit THOCC, the Hospital of Central Connecticut.org/maternity. Thank you so much for being with us.
Thanks for having us.